Good morning, everyone. I am Dr.Swarupa Mitra from Rajiv Gandhi Cancer Institute and from Healthyho. I am talking to you about a cancer, which is the commonest cancer in women, breast cancer. And this I bring on the occasion of a women's festival, a very important women's festival, that is Karwa Chauth. I congratulate all women today. So I'm going to talk about breast cancer only because it is the commonest cancer in India and in northern India specifically. If we go to rural India, it is still the second most common cancer in women. If you want to see the statistics, it is 25 to 30% of cancers in women in India. I'm talking about the statistics in India. And if we start counting, then every 4 seconds, one woman is getting detected with cancer. And at the same time, if you understand, every 13 seconds, we are losing a woman to breast cancer. So you can imagine how crucial it is to understand and get breast cancer treated early. There is another reason why breast cancer needs to be discussed very well, because breast cancer is a curable cancer, it is a treatable cancer only if it's detected early. And this detected early. To detect it early, it is also very simple. You can do it at home and you just need to be aware of the symptoms. These days, if I want to tell you the situation today, breast cancer is becoming a threat in the sense that we are getting more and more cancers in young women, that is women less than 30 years of age. So, and the cancers in women, younger age group, they are generally more aggressive and they need more acute treatment and more strategic treatment. The other reason is that breast cancer is now the commonest cancer in northern India, in Delhi and Punjab. So, how do we know that we have a cancer, and how do we know that these are the symptoms which can be a cancer harbinger and I need to go to a doctor? So the main symptoms. First, there may not be any symptoms at all. So we have to be just aware, and there are a few screening procedures we need to do. I shall come to that, but first the symptoms. Any lump in the breast, in the axilla or in the neck. So they should be taken very critically or very seriously. This lump can be very small, a large one, or of whatever consistency. So any lump in the breast should be taken care of. Any discharge in the nipple, any kind of discharge, whether it be a bloody discharge or a serous discharge or a green colored discharge, any colored discharge from the nipple, you should go to a doctor. If you see both the breasts, is there any difference in size of the breasts, any difference in the size of the nipple, a retraction of the nipple? These things should be taken care of. Any change in the skin color, any change in the texture of the skin of a breast or both breasts should be taken care of. So these are the symptoms which may later on grow into cancer. So how do we detect them? What do we do that we can detect them early? The first and very, very easy is a screening procedure which can be done at home without spending our money. This is called the self-breast examination. So there are 3 screening procedures: the self-breast examination, the clinical breast examination, and a mammography. Self-breast examination is the simplest which any woman can do at home. So the guidelines are: a self-breast examination should be done by a woman more than 20 years of age after she has started the periods. When does she do it? She does it about 5 to 6 days after the periods. So you can mark that day in your calendar. And how do you do it? Go to a room, your bathroom or your bedroom, and it should be closed, it should be private, and you should have a mirror in front of you. So you stand in front of the mirror, remove your clothes, and just relax. And just relax, keep your hands on both sides of your shoulder, and then just watch yourself on the mirror, watch both your breasts. Ask yourself, see, are the breasts same in size? Again, both breasts are generally not same in size, but they should not be markedly different. So, are the breasts same in size? Are the level of the nipples same? Or it's not that one breast is sagging and other breast is not. Then look at the texture of the skin. Look at any discoloration in the skin. Look at the nipples. Are they in the same level or not? Is one nipple retracted or not? Is there any discharge from the nipple or not? Then after that, raise your hands by your sides, above your head. Look at the axilla, both the axillas, and look for the same things. And then again, bring your arms down your sides and look at your neck. So these are the things you need to see. You're not touching your body, just see. The next step is touching your body, touching the breasts. So standing in the front of the mirror, first the left breast with the right palm and the right breast with the left arm. So how do you do it? Just relax, stand in front of the mirror, and you need to go to somebody, because in this setup I will not be able to tell you how to do it, but there are lots of videos, and you could go to your primary center or your physician who will show you how to do a breast examination. But largely the left breast is done with the right palm. Lie your palm flat on the breast and feel it with the tip of your fingers and just roll it. So you can roll it in a clockwise or an anti-clockwise direction and go all around your breast, clockwise or anti-clockwise, or you can go spokewise this way also. No part of the breast should be left untouched. So this is the way we go, and either clockwise or anti-clockwise or going spokewise from the nipple inward or outward. Similarly, look with the right palm, look at your left axilla and your left neck. Repeat this procedure on your right breast, right axilla, right neck with the left palm. So this way you're not going to miss anything. So this is called the self-breast examination. This should be done once in a month and about 5 to 6 days after you have had your periods. The second is the clinical breast examination. This should be done again in about 1 or 2 years depending on your risk category. So this should be done by a trained physician. The frequency of a clinical breast examination should be more for women who has a family history. Now, before I forget, the family history, it is not that all women who has a family history are supposed to get breast cancer. No, it is not so, but yes, your risk factors are more. So these are the women who have a family history of breast cancer should visit a breast surgeon or an oncologist more frequently than your counterparts. So this is clinical breast examination. And the last and most important is the mammography. The mammography is important in women who are more than 40 or 45 years. Before that age group, the breasts are generally, they are firmer and they are denser. So mammography may not be the ideal way of doing or screening a breast which is a dense breast. And ultrasonography may be required along with the mammography to see a dense breast. But after the age of 40 to 45 years, a mammography screening should be done about once a year or maybe twice a year depending on your risk categories. So this is how you do the screening, and this is very important, and at least the self-breast examination should be inducted in your life or in your lifestyle. Now, who are the women who are at risk? How do you know that you are at risk or not? Like I said, all of us are at risk, but who are at a higher risk? If you have a family history means your mother's sister, that is your maternal aunt, your own sister, and your mother's side. If you have a family history of these relatives who are suffering from breast cancer or ovarian cancer or an endometrial cancer, then probably you are at a more risk. So for such women, there are many tests these days, which are the genetic tests. There are genetic counselors who see that how much risk you are in for, and accordingly they will give you a set of tests or the battery of tests or a counseling to see that what you should do to keep yourself away from this breast cancer. You cannot actually prevent it, but how to detect yourself earlier. So these are the risk factors. And what are the other risk factors? Yes, women who are obese, your lifestyle, that is less of activity in your lifestyle, more of fat in your diet. Women who has lesser children or no children at all, which we call as nulliparous, so they are at more risk. Women who are married late, women who have had their first child late, they are at a higher risk of developing breast cancers. Others are, of course, your lifestyle, your sedentary habit, fat or obesity, diabetes, and having of more of alcohol. These are the women who are at a risk category. Women who have had early menses and a late menopause, they are also at a risk of breast cancer. So if you need to know all these criteria, and this is basically the awareness. So the more aware you are, you detect your symptoms early and you go to a doctor earlier, and hence you get treated early. So for any cancer, the earlier you get detected, the chances of getting cured are more, and mind you, your cost or expensiveness, that is your expenses, are lesser. So the earlier you get detected, the chances of cure are more, and your cost is less, your expenses are less. And if you get detected later, that is in the third and the fourth stage, which are generally not the curable stage, you are given just a palliative treatment to extend your life. So, and at this stage, your expenses are much more, and your chances of getting detected is earlier. So the reason I'm stressing this is because that you should not hide your symptoms. Even if you have slightest symptoms, it may be very silly sometimes, but yes, it is better to be silly for once than regret later. So any symptoms, go to a doctor, your nearest doctor or your physician, or preferably an oncologist, and get yourself screened and detected. All cancer centers, most of the cancer centers, they have a preventive oncology department. Preventive oncology department is a department where women or men, they come to get themselves screened for cancer. They may not have any symptoms at all, but you just go to a doctor and give your lifestyle, give your details, she will take your details, and she will tell you the tests needed for you to get screened for cancer. They are separate for all ages, and they are separate for men and women and children. So this is all I need to say today. Wish you all the best and have a very great day. Thank you.